Hi, I'm David Savage. I'm an emergency physician at the Thunder Bay Regional Health Sciences Center and an assistant professor at NOSM University. Thanks for joining me today to view my poster. The title of our study is Staffing Rural Emergency Departments, the Who, What, and Where. And now for some background. Rural patients face challenges in accessing primary care, and as a result, the emergency department has become an essential place for meeting a community's healthcare needs. A survey in 2017 of rural emergency departments in Canada showed that more than 40% faced physician shortages with the expectation that it would get worse over the next decade. For this study, we had two objectives. We wanted to describe both the demographics and practice patterns of physicians providing emergency medicine services throughout rural Ontario. Methods. We used the ICS physician database and the OHIP billing database from 2017 for the study and accessed it over a virtual network at ICS through their DAS program. We then identified 18 distinct services that these physicians could provide based on Sentinel billing codes. The rural family physicians were extracted from the overall physician dataset, and using the Sentinel billing codes, we determined the different services that these physicians were providing. The demographic and practice patterns of these physicians were then compared. Results. The data shows that there are approximately 1,192 rural family physicians in Ontario. Of those, 424 practice in Northern Ontario. About 52% of these rural physicians practice emergency medicine, and about 40% are identified as female. The majority of these physicians are in the 30 to 49 age range and are in the first decade of their practice. We see a large decrease in the number of rural physicians practicing emergency medicine in the second and third decade of their career. These physicians spend approximately 32% of their days working in the emergency department. They also provide on average 4.2 different services to their communities. In addition to emergency medicine, these physicians are often working in clinics, providing palliative care, hospital medicine, mental health, long-term care services. Summary and conclusions. With the significant gap in health human resources in rural communities, we need a new approach to planning, recruiting, and retaining a rural health workforce. This study provides important data on the diversity of clinical practices of rural physicians working in emergency medicine and can be used in forecasting models. And finally, this study demonstrates the importance of supporting rural generalist physicians to maintain their full spectrum practice throughout their career. Thank you for viewing my poster.